Hi, everyone, and welcome to Webinar Wednesday. We're glad to have you with us for today's presentation featuring Rich DeFabritus, Senior Director, Product Marketing of CyberMDX. Rich will provide key insights from a study of hospital executives in information technology and information security roles, as well as BioMed technicians and engineers. Webinar Wednesday would like to thank our sponsor, CyberMDX. CyberMDX believes medical device security is essential to quality care delivery. Their mission is to enable healthcare delivery organizations worldwide to provide quality care by securing and protecting the systems and devices you rely on every day to treat illnesses and save lives. For more information, please visit cybermdx.com. A few announcements before we get started today. Don't miss our 20th anniversary celebration at MD Expo in Atlanta on April 11th through the 13th this year. MD Expo strives to provide healthcare technology management professionals with a unique, intimate, and rewarding conference second to none. You can find all the details and registration at mdexposhow.com. Let's give one lucky attendee the opportunity to win a Webinar Wednesday shirt by answering the following question. CyberMDX offers a no-cost version of their security suite to enable you to see what you need to protect. This is the first crucial step in securing your organization. What is this edition called? You can find the answer by visiting our sponsor's website. Please use the questions feature on the webinar dashboard to submit your answer. As always, today's webinar is eligible for one continuing education credit from the ACI. You can obtain your certificate by completing the post-webinar survey. More details on this at the end of today's webinar. We'll wrap up today with a live Q&A. You can submit your questions at any time during the webinar by using the questions feature. We'll get to as many attendee questions as time allows. As I mentioned earlier, our speaker today is Rich DeFabritus. Rich, you may begin whenever you are ready.
Thanks, Jennifer, and thanks everyone for taking time out of your busy schedules to join us for today's session on perspectives in healthcare security. As mentioned, we did a study, and I will talk a little bit about that in a moment. But first, just want to give you a background about CyberMDX in case you're not aware of who we are. We are a mission-based organization. And our mission is to enable healthcare delivery organizations just like yours to provide quality care by securing and protecting the systems and devices that you rely on every day to treat illnesses and save lives. We do that through a very unique approach, something we call device-centric risk management, which is a methodology that wraps layers of security around your medical devices, around your network, and around the perimeter of your network. Now, if you've heard me speak before, sometimes my wife says I'm nothing if not repetitive. I like to say that I'm biased. Okay, so I can tell you how great we are, but don't take it from me. Take it from the experts. We've been cited by analyst firms such as Forrester or Frost & Sullivan as a leader in the connected medical device security space. And we've been the recipient of numerous awards, including the MedTech Breakthrough Award for the best healthcare network security solution. And most recently, we took 5 gold medal awards from the Cybersecurity Excellence Awards in 2022. Your peers, those that are using our solution, have rated us on Gartner Peer Insights. We have the most 5-star ratings on Gartner Peer Insights, so it's a testament to what we do, what we provide, and supporting that mission. And we have clients such as Northwestern Medicine, Michigan Medicine, Englewood Health, amongst others, some of the largest healthcare networks in the country or in the world. I did say we're mission-based. So one of the things we do, and we do this, no charge, we don't make money doing this. We have a significant research arm, a vulnerability research arm, CyberMDX Research. And we work closely with organizations such as CISA, MITRE and the FDA, as well as major medical device manufacturers, to identify potential vulnerabilities that they have in the devices with the goal of remediating them or rectifying them so that patient safety and quality care can be delivered. And the last thing I just want to say,
Rich,
yes.
let me interrupt you really quickly. Sorry, but your screen is not sharing, so I'd like for you to go back into presentation mode if you could. Perfect.
Okay.
Thank you so much.
Is it sharing now?
Yes, that's perfect. Thank you. That's perfect.
Okay. Yeah,
Thank you.
I'm tabbing back and forth. Thank you. So last bit, you may have noticed we were acquired by Forescout, if you saw the news. So we are now a Forescout company. And together, Forescout and CyberMDX offer a powerful platform that delivers device visibility, classification, threat detection, and incident response to better serve your healthcare organizations. So let's go ahead and get into it. We did co-sponsor a survey. We did this with our partner, Philips. The survey was conducted by Ipsos. It was a survey of 130 US hospitals with the goal of understanding the differences in the attitudes and the concerns about cybersecurity from biomedical and security professionals, which Jennifer mentioned up top. Keep in mind what you're going to see here are some very interesting results. And a lot of that may be due to various reasons, but one of which, I would say keep in the back of your mind that cybersecurity and the awareness of cybersecurity and the thoughtfulness here is largely emerging. Okay, it's not to say that healthcare delivery organizations are lagging. That's not what I mean, but I'd say that cybersecurity may have been more traditionally the domain of IT professionals, and we're very quickly moving into a world where it's the domain or it's the responsibility of everybody in the organization. So the key takeaway of what I'm going to talk about is that perceptions and realities aren't really aligned, right? What people were concerned about differed greatly from their actions, right? Where almost universally everybody cited that cybersecurity is something of high concern, their actions showed that they invested in other priorities. Okay, where they're experiencing rampant attacks and shutdowns, and that's impacting them financially, reputationally, yet massive amounts of vulnerabilities are left unchecked. And again, I'll back this up with the detailed data. They note that they have a lack of automation, yet if they don't have automated processes or tools to help automate the processes, then they should have the required staff in place to do it manually, even though that might not be optimal, yet there are staffing disconnects. Okay, so keep all this stuff in mind as we go through this, and I think you'll find it's very interesting. Okay, so the first question we asked was to look at the impact of a device shutdown or a network shutdown or some kind of a shutdown in the network. And this is really broken down between proactively shutting something down from an attack to sort of mitigate or prevent further propagation of ransomware through a network versus a forced shutdown, which is the ransomware attackers shut down your network. And I should add one other thing here you're going to see on some of the other slides. We didn't just speak to biomedical and IT security professionals. We also split this between small, mid-size, and large hospitals. So you'll see some disparities there as well. Okay, now the one thing that's very interesting here is you can see the difference between what the IT professional said and the biomedical professional said in terms of the number of hours of downtime they'd have from an external attack, forced shutdown. IT personnel said it's about 13 hours, where biomedical people said it's about 4 hours. What's the disconnect? Because both numbers can't be right, but it kind of supports the need to get everyone aligned. Biomedical teams, may just be unaware of how impactful the shutdown is, or it could just be that IT professionals tend to have a broader definition of what maybe a medical device or connected medical device is, whereas a biomedical or clinical professional knows it's this particular, say maybe an MRI machine or something like that, an IT person might consider a tablet to be part of that, or a server connected to a device as part of that. That could also explain what the difference is. But nonetheless, I think the most important thing you want to take away from this is we also asked about the cost impact, okay? And the IT security people said it's about $80,000 an hour of cost from a shutdown. And when you consider if the average or the number of hours they're seeing from a device shutdown is close to 13 hours multiplied by $80,000 per hour, you're talking about maybe $1 to $2 million a day. Now, why is that important? Because we've seen some shutdowns last weeks, right? So consider how big of a problem this could be if an organization is hit by a cyber attack. So I said, we split this down between small, mid-size, and larger hospitals. Mid-size hospitals are feeling more pain, as evidenced by the fact that they said a device shutdown costs about $45,000, almost $46,000 an hour, versus about $21,000 an hour for a large organization. And this is average across all the different types of shutdowns, not just the forced shutdowns, right? So that's very interesting, and could be because they have less resources and need a little more time to recover. Or it may also be because a larger health system are able to divert patients and not interrupt patient care. They can divert them to other resources they have at their disposal more readily than a smaller hospital. And that way they can minimize the loss of patient revenue, which typically costs more than the cost of remediating a problem. So, but again, keeping in mind, a mid-sized hospital is likely to feel more pain there for a multitude of reasons. Okay, as I prefaced, early on, concerns are extremely high, right? And on a scale of 1 to 7, we asked, these folks and the different organizations. Ipsos rates these on a scale of 1 to 7, and almost universally, pre-COVID, everybody said cybersecurity attacks in the healthcare industry are very concerning to them, right? Whether that's in their actual hospital or whether that's, it's a general healthcare industry. And a good portion did cite that medical devices are in fact a vector for cybersecurity attacks. And we asked that question because at times they tend to take a background role here, even though it's critically important, particularly from a compliance perspective, amongst other things, that your medical devices could potentially be hacked. It could potentially be impacted by a cyber attack. Okay, now post-COVID, you see the numbers are still pretty strong. In fact, they've gone up. Part of that could be due to, if you remember a few years back, if anybody here is cybersecurity aware, the WannaCry attack in the UK. Prior to the WannaCry attack, ransomware was, for the most part, something that IT and security professionals really concern themselves with. Once WannaCry happened, it became a household word. So post-COVID, we expect to see that rise. That's a good thing. We should also keep in mind that ransomware attacks have risen significantly over the past few years, and are pretty much doubling on a month-to-month basis, in terms of how many are happening. So all of this is contributing or factoring into why the concerns are so high. And as I sort of alluded to, the medical devices are still considered extremely critical. Both from a personal perspective. So, again, if you're a BioMed or you're an IT person, nearly 3/4 of everybody interviewed said that's critical if the device is shut down. And that's obvious. Nobody wants it to be shut down because patient care is impacted. But the same applied from a C-suite level. Okay, so we can speculate that this is all tied to patient safety and revenue to a lesser extent, as well as operational. But now the question you really have to ask is how prepared, if you consider the medical device to be a vector and you consider that their operations, continued operations, are critical, how prepared is the organization to a cyber attack? Now, bear in mind that I said nearly universally, everybody said cybersecurity is a concern, right? What did we say? 3/4 to 80%. Okay, and it's stated here, 78 up to 78% rated cyber and medical device attacks is extremely concerning. But the actual spend on cybersecurity was far different, right? Only 11% had cybersecurity as a high priority spend, meaning budget is allocated with cybersecurity being specifically near, the top of the list. Nearly 75% or more than 75% of the organizations had other IT spend as a higher priority. Okay, so when we published this report, I can tell you that this caused a pretty big stir. This is one of the big takeaways, or the real big punchlines from this survey or this report. It could be that hospitals don't have budget, right? And they just can't allocate it, or it may just be related to keeping the general IT infrastructure up and running, which makes sense because, if you don't have a general IT network working, regardless of, the devices, you're going to have a difficult time getting patients in and out. And so it's understandable to some degree, but again, it really speaks to that there needs to be a single source of truth where everybody can see where the issues are and everybody's working from the same plan. Part of this could just simply be a disconnect. And disconnect meaning, the IT and biomedical professionals see the problem is very big and are asking for the budget. From a management perspective, maybe they don't see it. Again, these are, I'm speculating about why, but it's very eye-opening to see that you can say it but not do it. That's a big concern. Okay. And why is it a big concern? Because as I also said in the summary earlier, many vulnerabilities persist. Okay, and we're not talking about vulnerabilities that were published within the last week. I mentioned WannaCry, which is 4 or 5 years old. Okay, and almost across the board, still 64, 65% of hospitals are not protected. And this is their words, right? These are IT people, these are biomedical people in mid-sized to large hospitals. Almost universally across the board, WannaCry is still a problem. Okay, still potentially they're exposed to it. Okay, and you can move up the stack here. Ryuk, that's at least a year old. MD-Hex or MD-Hexray, those are vulnerabilities that our research team uncovered in medical devices. Almost 70% are still exposed to it. And then NotPetya, which was pretty big in the news as well. Nearly 3/4 or 3/4 and up are still exposed to it. What's even more eye-opening is if you look at the bottom band, we say 20 to 25% have no protection for any of the listed vulnerabilities. Okay, and the question being, are your devices protected against the following vulnerabilities? Okay, so we understand that there are issues with this, right? There's thousands of devices in a hospital organization, and to protect them, it's a huge task, right? You need to collect MDS2 documents. You need all the vulnerability tables. You need to acquire all the patches when vendors put them out and apply them to the systems. The evolution to move to network-based systems to relieve the burden is really critical, right? You have to be looking at some sort of automation to alleviate the need to collect and aggregate all of that information, so okay, because you can make the assumption the reason they persist is there's simply not the resource available to address it. Okay, meaning A, there's no automation, or B, not enough people, and or C, all of the above. Okay, so very eye-opening. And as I said, lack of automation is partially creating a security gap. First thing you want to do when you try to secure an organization, and this is beyond medical devices, to secure anything, you've got to know what you have, right? You have to have a basic understanding of the exact number of devices that you have on your network, again, what's the vulnerabilities that exist? What's the latest software rev? Do they need to be patched? Are there FDA recalls? Yada yada yada. Right? Only 1/4 of the organizations know exactly what it is that they have in terms of devices. Okay, and that overlays really well with the inventory policy on the right, how many actually have an automated software system or a solution that allows them to have full visibility to all the devices. Numbers are a little off, but roughly close. Say 1/4 of the hospitals out there are using some sort of a tool, again, like what CyberMDX offers with our healthcare security suite, to tell exactly what they have and all that data, okay? What's a little more shocking is that many of them have some mix of automation and manual inventory processes, or they're even fully manual. Okay, so I can't even surmise what that looks like. It's probably kept in spreadsheets or something like that. And they're the ones who can say that we don't have any way of determining exactly what we have. The more likely, reality is that many hospitals are using something like a CMMS system. Okay, so they can catalog some of the details, but there are times when devices moved, they get swapped out, they get retired, they're moved into a back room, and that heightens the criticality to get the inventory with the details. Okay, so again, it's okay to be in that middle band. I kind of know what I have, but I don't know the exact number. I don't know the exact details. Okay, so you're only halfway there, if that, right? So now you can see where the story is being woven and told here. They simply don't have the automation in place. So I talked a little bit about, healthcare being targeted, and I think it's a good time to take a step back and talk about that. These gaps, and what do we have to do to sort of address the gaps, right? Through May of 2021, there were 82 ransomware incidents. Okay, and obviously since May of 2021, it's gone up quite a bit. Nearly 60% of those were in the United States. So we know hospitals are being targeted. That's a very big number. If I take, say that's roughly half the year and multiply that through, we're looking at, 164, maybe closer to 200 ransomware attacks. That's quite a bit. 30% of those of large data breaches, so beyond ransomware attacks, are to hospitals. So any kind of a large data breach, 30% of all the data breaches, all the attacks in the United States are with hospitals, okay? And then on top of all that, healthcare cybersecurity roles take a lot longer to fill compared to IT jobs in other industries, about 70% longer, okay? And it's very hard to hire, it's hard to find the talent. So what you're seeing is sort of this perfect storm, as we like to say, right? There's a high rate of attack. They're coming with increasing intensity, with increasing volume, and hospitals don't have the resources in terms of human resource or automation resources to adequately protect the devices. Ultimately, that will certainly have an impact on, not only, as I said, financial risk or reputational risk, could ultimately lead to an issue with patient safety. So let's dive a little deeper in that. Is there a staffing disconnect, right? You see the cite from the article from Beckers that I said. Are hospitals actually saying this? Do they feel it, right? And so, interestingly enough, 68% of IT feel they are adequately or overstaffed for cybersecurity. So this is general cybersecurity, the overall security posture of the organization. Yeah, we've got almost 70% of IT people say, yeah, we're in good shape. Biomedical professionals, not so much. They about 50-50 feel they're adequately staffed, right, for cybersecurity. And some of that may be, again, the emerging, need for biomedicals to be much more security aware, become, ingrained in those processes, et cetera. But that's sort of an outlier, because you can see with the hospitals, the size not being sort of a factor here, 60 to 70% feel like they're adequately staffed. Now that sounds great until you realize that they're being attacked at such a great rate. What are we missing? Okay, and you guys can't see me at the moment. I'm a very animated type. My hands are flailing in the air and gesturing wildly because it's almost frustrating. The what they're saying and what's happening are at complete opposite ends of the spectrum, right? When we filter that down to medical device and IoT security, now you see sort of the change in attitudes. They're a lot less confident about whether those devices are adequately staffed for security, and ultimately the inference being secure, right? So they don't have the expertise on the medical devices. They have it in general, not so much on the devices or IoT. This is what we tend to call the blind spot. Okay, I'd say the biomeds are a little more confident. Again, very consistent with general to medical device, but then probably because medical devices are the primary focal point. Okay, but again, very interesting that everybody thinks, or not everybody, but a large majority thinks, nope, we're good in staffing. Yet the data shows you don't have the automation in place, and you don't have the vulnerabilities patched, and the number of attacks are rising. So it is a very interesting piece of feedback. And let's look at the impact of insurance and compliance on the job role. Okay, because both are really tied very closely to cybersecurity. And the thing that we tend to talk about is, are they creating a false sense of protection? And I'll take a moment to talk a little bit about that. But before I get to that, let's talk through some of the numbers and what's behind it. Nearly everybody has to work with compliance teams and understand how it connects with their role. And we know that HIPAA plays a huge factor. Okay, let's make sure my screen sharing wasn't paused. We know that plays a big role. To get cyber insurance, you need to have a high degree of compliance. The more you comply with protecting the organization, the more likely you're going to get cyber insurance, right? So the good news here is that a good amount of people either feel that compliance has a very high or moderate impact on cybersecurity purchases and on the role that they have in the organization. So very few people said there's low impact. Again, HIPAA, amongst other things, it's ingrained in us. We know, and that includes us at CyberMDX. We have to be HIPAA compliant also, so we relate and understand. Any kind of compliance, good to know, okay? The thing I will talk about, though, is, I said compliance can kind of lead to cyber insurance. And if you're not aware about cyber insurance, obviously it's insurance that, gives you some sort of remuneration in the event of an attack, to sort of cover potential losses. Is it creating a false sense of protection? Well, I'll leave you with this as the story that I wanted to dig a little deeper into. I recently came across an interview. It was an anonymous interview conducted with a cyber hacker with the Revil attack group. And this person said that they spend a lot of time attacking and or hacking the insurers themselves to get information on hospitals that are using cyber insurance, and then they will specifically target hospitals with cyber insurance because they understand having that insurance in place is all but a guarantee of a payout. So the very thing you think is working to help you could in fact be working against you in terms of being a target for an attack. Okay, so it is a very interesting point of view, and I recently led a roundtable on it, and we're talking really here about attitudes and concerns. And I found the roundtable exchanges were very interesting, as if people were sort of dancing around the subject. They didn't want to talk too much about whether or not they had insurance, but they did talk a lot about the difficulties with it. Again, having being compliant, and being compliant in certain ways, not just like things like HIPAA compliance, but being compliant like you have to have multi-factor authorization implemented in your organization. And then the discussion turned to whether or not that needs to be internal to the organization. And there's some thoughts that it may be coming down. But it was a very interesting discussion in the sense that people wanted to sort of dance around it. It's a controversial subject. It's definitely not the panacea for resolving cyber security problems. It's a piece of a puzzle, or it's a part of a larger cog or a larger wheel that hospitals need to pay attention to the things that I talked about on some of the previous slides, because again, you're seeing an increase in attacks. You're not seeing the controls being put in place to sort of mitigate the attacks. You're not seeing the human resource being applied. We're not seeing vulnerabilities be patched. And so all of this becomes sort of overwhelming, and it's kind of a wave. And maybe there's a sense that if we are able to get a pretty good cyber insurance policy, we sort of covered ourselves in the event of a significant breach. I want to say that that's not that it's further than, nothing could be further than the truth, but I'd like to say that it would be, again, a false sense of security if you're going that route. So what can be done, right? We talked through quite a few different things, rather eye-opening. If you are knowing, I've done a few Tech Nation webinars. I know, many of you are clinical and biomedical professionals, so that security is obviously a very important part of what you do. And I kind of prefaced earlier about, it's now the responsibility of everyone in an organization. I've told stories in the past. I can tell the story here that everybody needs to be engaged. Many organizations engage in cybersecurity training. Interestingly enough, according to a recent study conducted by HIMSS, just about a quarter of all of hospitals in the United States don't do any sort of cybersecurity training for their employees. It's kind of surprising. As part of that study, there was a KPI, a goal that if an email, like a suspicious email, was sent to people in the organization, we want less than 10% of the people in the organization during this test to click on the email. So roughly about, I'd say, 30% or a little higher, we're in that 10% and under range. The rest, we're over it. Okay, so what am I telling you in a sort of long-winded way? Just like the insurance, simply having training isn't enough. Okay, and that's my first, what can we do? When I say align the impacts and priorities across departments, everybody really needs to take this seriously. Okay, and when we say take it seriously, it's not just talking the talk, it's walking the walk. It's not rolling your eyes, and I'm saying you doing this. I'd say more like me in the past. You roll your eyes when those tests come down, or oh, we've got to get certified, we've got to do this training, we got to do this. It's serious, okay? And I think the data has shown that. Everybody needs to be aligned to the fact that if a breach happens, it costs $1 million a day. Again, that's a sort of an assumption number, but it's significant, right? And you can look at things even beyond fines. You can look at some recent ransomware attacks or some shutdowns, and you can see the impact. That's not counting the impact to patient outcomes, which I was discussing with somebody earlier today. We may not have had a direct negative patient outcome due to a ransomware attack, but I'm pretty sure it was the AHA that published stats that said the delay in patient care, so say a 2-week shutdown causes a 2-week delay in critical care, absolutely accelerated the negative patient outcome, right? But you can kind of infer what I'm talking about, okay? It's critical that you look beyond the financial, beyond the reputational, and understand that there's a patient safety risk here. Everybody needs to be aligned to the fact that that's the ultimate piece of the puzzle, the ultimate, end state, right? You have to ensure patient safety. You have to ensure that resources are focused on protecting really the most critical assets, okay? These are like the medical devices. These are the ones with the vulnerabilities that are known. And you want to make sure that healthcare stays continuous, that you don't have a delay to patient care, as I talked about, right? Again, WannaCry situation there, the shutdown was relatively short, but they did have to turn patients away. They had to turn patients that were coming in maybe for chemotherapy treatments and things like that. And that's actually true. That's not something I made up. They turned people away. You have to keep healthcare continuous. You have to address what's the most critical issue, what's the most critical vulnerability we have. It can be exploited at any time and a shutdown occurs, right? So when I talked about those vulnerabilities on the one slide, understand what some of those might be. There may be standard passwords that are known and you can't change them. 1, 2, 3, 4, 5, 6. A hacker knows that, and then they have access to your network and they can propagate malware throughout that network. Okay. In the case of WannaCry, it was unsupported Windows operating systems. Windows has a couple older operating systems that Microsoft no longer supports. Yet, how many devices are still running those older versions of Windows? What's being done to upgrade them or take them out of service? And the NHS admitted it. They said we had something like 70% of our devices were still running the old Windows software. So when I showed on that other slide how many 60% of these organizations are still potentially exposed to WannaCry, there's a good chance they're running older versions of unsupported versions of Windows on some of those devices, right? I talked about the manual work piece, the lack of automation. You really do have to assess how much manual work is being done. There's a cost involved there, right? And cost is not just monetary, okay? What's being consumed by having that resource do manual work as opposed to otherwise being focused on the real problem, the security issue, right? You as BioMed professionals understand this probably more than anybody, right? If you're manually keeping inventory and tracking devices, which I hope almost none of you are, that would be a nightmare. Numbers probably changed. I think I saw a statistic that said the average biomedical professional manages the life cycle of 2,000 to 3,000 devices. That's a lot. You need something to help you make that easier so you can focus on really the important part of the job, right? And a piece of that being security. And then measuring against the holistic problem, okay? When I say the holistic problem, okay, I've talked a little bit earlier about how ransomware was once the domain or the responsibility or in the wheelhouse or in the sight of the IT professional. So the IT security professional is talking, wants investment in, for those things, right? For things to protect against. That's no longer the case, and we can't have fiefdoms that say, well, we need security or we need this or we need that. It's a across the board problem, and the investment has to be made as it is in a across the board problem. It's not the needs of just one particular team over any other. You got to make sure those priorities are clear across the entire organization, making the investment in that fashion, and the communication, north and south between management or executive leadership and functional groups and leadership of functional groups is aligned, right? It is no longer a single group's responsibility, that being security. So with that, I'd like to say thank you and open it up for questions. So Jennifer, if we want to open it up.
Thank you so much, Rich, for all of this valuable information. As a reminder to our audience, if you have a question for Rich, please use the questions feature on your webinar dashboard to submit them. We do have a few questions that have come in already, so we'll start with those. Our first question, Rich, is, and your screen has gone back to, it's out of, there you go, perfect. All right, our first question is.
What happens when you see it go away? Does it just go blank?
No, it just goes to where you can see the slides that are upcoming and previous.
Ah, gotcha. Okay.
All right, our first question is, do you have insight into C-suite or IT leadership beliefs about who is responsible for remediating cyber risks on medical devices? Is it IT? Is it BioMed? Is it a combination or other?
Yeah, right. That's a great question. So, keeping in mind, as I said, it's really not an easy question to answer because everybody treats it differently, but it should be a collaboration, right? And I talked about biomedicals are becoming, much more security aware, being much more involved in it, have a better understanding. That helps posture moving forward. Keep in mind too, device manufacturers and OEMs should be upgrading and patching equipment. So I'd be looking at them to help outline, as part of a service level agreement, making sure your devices are patched and up to date. But ultimately, at the end of the day, no one person is responsible for remediating, on a medical device, right? And I think the question really is about the device itself. So you may have organizations where one, security says, well, that's not my responsibility. The biomedical team, they manage the life cycle of these devices. They should do it. The biomedical team might be saying, well, no, I'm biomedical. I manage the life cycle of the device. I can certainly take it out, put it in, whatever. But the security team, they got to secure it. It's on a network. We've probably moved past that, right? Again, I'm not a biomedical person, so I, can't speak entirely to it, but I know a few, and obviously, they've talked to me and we've spoken about how much more important it is to be security minded. And then there's sort of this other paradigm we've seen, and that is the organizations are sort of being merged into one another. So I've met with quite a few CISOs and CIOs that have biomedical teams underneath them, which is really interesting to me. But I would say ultimately it's still across the organization responsibility. It's not a single group or a single person's responsibility.
Great, thank you. Our next question is, what do you recommend from a fact or statistical-based perspective that can be used to secure funding for cybersecurity programs?
Right. Okay. So I talked a little bit about how the hospitals are really amongst the most, targeted organizations, and so that alone is a proof point that can help you, go back to management and get funding in place. I did talk about, the disconnect and doing something about it. One thing you can do is sort of benchmark against others in the industry. See where you are against peer hospitals. If there's data you can leverage, there, that's something that, could be a big part of, getting funding, or going to, say, executive leadership and saying, hey, look, we're really lagging here. Some of the data here talks to that. And I would also say, sort of like the slide I just had before, what can we do, right? Just before this one, if I, go back one. A lot of this could be leveraged for a business case, right? If you take each one of these bullets and address and or answer them in a business case, it's something that could be presented upwardly to say, this is why we need funding, right? Understanding some of the things we talked about. We have, making the numbers up, 5,000 devices that still have vulnerability, are still vulnerable to, Ryuk ransomware. And it's going to cost us X amount of time and dollars to manually address those. And the problem will lead to X across the organization, the holistic problem, right? So these are ways that you can use the methods you can use to get funding from maybe, executive leadership.
All right, our next question for you, Rich, is I work for a mid-sized hospital, and I think we feel constrained by resources. Are there any shortcuts you can recommend so that we can do more for less?
Yeah, so I can be biased here, right? I mean, the first thing is, making it easy for someone to use our solution, which not only identifies where your risk is, it, scores it on criticality, it provides recommendations for remediation. We just launched something we call the freemium edition. It's a single user targeted at both IT security and biomedical professionals that allows you to get sort of visibility into what you have and some of that detailed data, obviously being freemium. It's no cost, but it's also sort of limited, right? Just to give you a flavor of, what it is we can do. Ultimately, if you don't have something like that in place that shows you how to protect, that's probably the place you want to start. So, even though I would like to turn you towards, what it is we do, understand that the data we provided, that's, hospital data, that's not ours, and it speaks to that, right? And so automation, that's what's needed. You always have to be sort of, as close as you can to, the bad guys, if you will, right? It would be hard to leapfrog the bad guys, but doing as much as you possibly can to prevent them, and being able to do that in an efficient way without consuming the resources, the needed resources for the hospital, that's the place I'd start. That's the easiest place to start.
All right, our next question is there a list of known vulnerable devices by manufacturer and model that is available, or is the publication of such a list potentially of potentially vulnerable devices too risky?
Okay, so that's an interesting question. There's a couple things that I can answer to it. I don't know if I'm not the expert on whether there's a list of the devices that are vulnerable, but there are lists of the vulnerabilities that exist. It may not tell you exactly which devices, although when we publish our vulnerability findings, they are specified in the devices, right? So if you were on CISA's website, they do publish a list of these vulnerability alerts. Now, the other thing that you could do, our solution is something that would allow you to see that by the manufacturer, by the device type, so on and so on and so forth. And that's updated regularly. It's updated in real time or near real time. So if you had, say, our solution in place and you had a series of devices from manufacturer, Acme, you could look up, show me all the Acme devices that are vulnerable. And if Acme makes imaging machines and infusion pumps, you could say, well, I only want to see the Acme imaging machines, or I only want to see all of the imaging machines, regardless of, device manufacturer. Those are the two things I could say. So the list of the vulnerabilities exists. The list of vulnerabilities may, in some cases, tell you the impacted devices. Again, I know from our own vulnerability disclosures, we do, again, working with those manufacturers, we do list what devices are impacted. And then ultimately, again, if that was something, because it could be difficult to aggregate that. If you go to CISA's website, there's just thousands of them, right? Our solution would be something that could tell you that, maybe in the format or the way that you want to see it, a little bit, maybe easier to aggregate or organize.
Thank you again, Rich, for your time today and for a great presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the services they provide to our industry. Please visit cybermdx.com. A quick reminder that you can obtain your CE certificate by completing today's post-webinar survey. This survey will be emailed to you 1 hour after the end of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar. Please visit webinarwednesday.live for more details and complimentary registration. Thank you all and have a great afternoon.